Part 1. General information about chest deformities. Definition. Pectus is a Latin noun, and it means chest. All the other adjectives which comes with the word pectus describes a different chest deformity. After reading numerous studies and reading online hundreds of personal stories, I made my own list of chest deformities. And now have a deeper look into each one of these. First, Pectus Excavatum, commonly known as sunken chest. The sternum is pushed in while the lower ribs are sticking out. Second, Pectus Carinatum, commonly known as pigeon chest. The breastbone is pushed out. Third, Pectus Excavatum and Pectus Carinatum complex. It's a mixed type. One side of the chest is pushed in, while the other side of the chest is pushed out. Fourth, asymmetrical Pectus Excavatum. One side of the chest is pushed in, while the other side of the chest curvature is in the normal range. Fifth, asymmetrical Pectus Carinatum. One side of the chest is pushed out, while the other side of the chest curvature is in the normal range. Sixth, Pectus arcuatum, commonly known as pouter pigeon chest and Pectus carinatum superior. Mixed type, the upper part of the breastbone is pushed out, while the lower part of the chest is pushed in with rib flaring. This chest deformity seems to be the most rigid out of all types. Part 2. Causes. Usually, Pectus deformities are hereditary, which means that it's in your genes. You can born with the deformity or you can develop it later on, as it is coded into your genome. Either case, Pectus deformities worsen over time if you get no treatment. Unusually, you can develop chest deformities due to an accident or surgery or by any injury which interrupts the harmonic development of your breastbone and your ribs. Part 3. Harmonic development of the sternum and the ribs. The harmonic development means that both your breastbone and your ribs grow at the same rate. The breastbone grows vertically while the ribs grow horizontally. Either way, your breastbone growth was slower than your ribs or vice versa, your ribs outgrew your breastbone, resulting in a deformity. Part 4. How to get a diagnosis, Haller index, and what to expect from your doctor. Well, obviously, I don't know about every country in the world, but I can speak what's the trend in Europe. First, you have to go to your local GP, general practitioner, and she is going to examine you and refer you to a specialized doctor. Now this can differ, but usually it's either an orthopedist or a thoracic surgeon. Personally, I was sent to an orthopedist, but he sent me to a thoracic surgeon. Now you tell everything about your condition and any related health problems. Now your doctor should send you to get a CT or an MRI scan. After you receive the results, your doctor now can measure your Haller index. Haller index is your chest inner width at its widest, divided by the distance between your sternum and your spine, anterior side. After this, the severity of your condition will be known. After the severity is known, your doctor is going to tell you your options. Usually, there are 3 outcomes. I can speak about the excavatum ones, because carinatum never seems to be life-threatening. First, you are a young teenager with a condition of mild or moderate. The doctor says you will outgrow this condition. If this is what you get as an answer, don't believe it, because your doctor is lying. Because without doing something against the condition, it doesn't go away by itself. Second outcome, you aren't a teenager, your growth has stopped. you are in your 20s or older, and your severity is mild or moderate, your doctor going to tell you this is only a cosmetic problem, you shouldn't worry about it. Third outcome, age doesn't matter, you have a severe case, and your doctor is telling you that surgery is basically your only option. Usually nose procedure, but sometimes they still use the Ravitch procedure. I'm going to tell you more about the surgery later in this video and why I don't recommend it at all. I have a suggestion. Beside a CT scan, I highly recommend you to tell your doctor to get an X-ray scan as well of your spine. You can say that you have spinal problems too, and you want to know how your spine is deformed, if it's deformed. I will explain why I think it's necessary. Part 5. Importance of the spine, breathing and chest deformity related conditions. As you're now aware that in the front your ribs are connected to your breastbone, but on the back your ribs are connected to your spine. Either way, your breastbone and ribcage growth wasn't synchronized, and it became either pushed in or pushed out. But what about your spine? The thing is, I never came across with someone who had asymmetricity in their chest deformity and didn't have spinal deformity too. Chest deformities goes hand in hand with spinal deformities. This is why an X-ray is important, because your progression to become healthy can be speed up if you target your spinal deformity too. Also, doctors found out in rare cases, asymmetric thoracolumbar scoliosis, chest deformities can worsen if the spine is corrected, and vice versa. If the chest is corrected, the spine can deteriorate. This study and also other spinal deformities and their correlation with chest deformities will be discussed deeper in another video. Breathing. Yes, you heard that right. Your breathing is more than likely wrong, and this is the other main cause of chest deformities. Most of us are chest or stress breathers. It means that you directly breathe into your chest. Now you're thinking, isn't that where my lungs are? Yes, you're right, but breathing directly into your chest isn't optimal at all. We only use it in high demand, stressful, fight or flight situations for a short period of time. If you lay down on your back and you breathe as you normally do, with one hand on your chest and one on your abdomen, the hand which is on your chest shouldn't move, because if you breathe correctly, you are using a dome-shaped muscle which is right between our chest and abdomen, called the diaphragm muscle. By using this muscle to breathe, it makes breathing much more efficient, less demanding, and it also eliminates rib flaring. More about this in depth with training techniques later on in another video. Also, I'm going to talk about my braces which will force you to breathe correctly. About the related physical conditions which may or may not correlate to chest deformities. Solely to list them in this video would be too long, so that alone will have its own in the future. Don't forget to subscribe. Part 6. My story. My story begins when I was around the age of 13, when I started to become taller than others. Looking back at the old pictures, I always had an odd chest, but it wasn't noticeable and there was no chest deformity present. But after the rapid growth, my chest along with my spine started to deform. I literally felt that my chest hurt on the right side. This is where my excavatum is. Also, back pain was constant. I went to the GP and she sent me to an orthopedist who was careless and told me I will outgrow this. At least he prescribed me physio and swimming, so actually I trained my core muscles and spinal stabilizers, also expanded my chest. The growth didn't stop. Despite the physio and swimming, my condition became worse by the day. At the age of 18, I said, it's enough, I wanted a solution for my problem. I've searched on the internet different forums. Keep in mind this was almost 8 years ago. And what I found that people stated on the forums that you cannot fix your chest deformity by alternative methods, only by surgery. You have no other options. Sadly, I believed them and went to a thoracic surgeon. He sent me to have a CT scan, and it turned out that my Haller index is 3.3. 3.3 is at the border where the condition is between moderate to severe, and this is the point where national insurance starts to cover the cost of the operation in my country. I wanted the surgery straight away, but my doctor didn't want to do it because he said it's only cosmetic. In reality, he didn't confess that my chest can't be solved by the regular NUS procedure, but only by the sandwich method, what he clearly wasn't capable of. I accepted this for a while. I calmed down and started university. My chest still bothered me. I was never really able to fully accept it. After I finished university, I decided, no matter what, this time I'm going under the knife. I went to a different surgeon, I got a new CT scan, and my new Haller index turned out to be 3.8. My chest significantly deteriorated, and the reason for that is that I stopped doing sports, physio and swimming, and I was sitting a lot with an awful posture. I underwent the procedure, and on that summer, regular NUS with 2 bars, 4 stabilizers, which was a nightmare. I felt the most intense pain in my life. Although I received epidural analgesic, together with opiates through my veins, the pain was still unbearable. But the physical pain was the smaller part of the problem. The bigger part was that all this was for nothing. My chest, although improved, but from a 3.8 Haller index it went back at best to a 3.3. I was devastated. My doctor told me to save himself that it's going to change over time. The surgery itself, the insane pain, the scars, which I will wear for life, was for nothing. For 4 months I was only able to sleep in a recliner. Even for more time, I couldn't lift anything heavy. My chest area, nipples, and where the scars are, to this very day feels numb, because maybe I suffered permanent nerve damage in these areas. From my lovely doctor, I haven't received any prescribed painkillers after the surgery, so I was left with what you can buy over the counter, and those worth absolutely nothing. I tried to get used to the bars, but I couldn't. The pain went down, but it's still there. I have to live with it till my removal surgery. Alcohol helped me ease the pain in the evenings, but I realized I became addicted, so I had to fully stop it. It wasn't easy. It cost me a year of my life, so I can tell you a good advice. Back to the subject. 1.5 years after my surgery, I came across a video where a Brazilian gentleman called Dr Sydney Haje gave an interview. This interview changed my view, and I read all the studies and publications what Dr Sydney Haje and his associates did. And now I will explain his non-surgical method to fix chest deformities, the proof of concept, and also my solution to some problems but he didn't manage to answer. Part 7. How to fix chest deformities without surgery. Fixing a chest deformity in a non-surgical way is similar to a teeth brace. Julius Wolff explained this type of treatment and later concluded that bone and cartilage are flexible substances that can be remodeled by external forces. Quote, "The bone tissue is a dynamic construction that can be modified according to exterior pressure." End of quote. Your body will adapt to the external pressure over time, and as a result, the shape of your ribs are gonna change. Okay, but how to put pressure on my chest? And where exactly? For how long? This is where Dr. Sydney Haje and his groundbreaking work come into play. 32 years long study from 1977 to 2009 with almost 2,500 patients, Pectus Excavatum, CARINATUM and other cases showed that dynamic bone remodeling indeed works. I put the study into the description. The patients received their special braces and they were advised to wear them for at least 23 hours a day and also doing special exercises while wearing the brace. But how you never heard about this? Western doctors want the results which are immediate, even if it's a serious surgery. Other than that, they may never even seen the study by Dr. Sydney Haje. Regardless, in those countries where this method isn't known, people which has deformities left with surgery or no treatment at all. But back to the topic, now let's see some real cases and how some people manage to fix themselves within months with bracing. Excavatum cases. The most interesting excavatum case of all, between the first A picture and the second B picture, the time difference is only 5 months. This young man managed to overcorrect his chest just within 5 months, and now let's see what brace he used. As you can see on the second picture, he got a brace on his lower ribs. And basically, this is a treatment for excavatum together with physical exercises. He overdid the exercises. This is why he created a minor pectus carinatum. In the fourth picture, you can see the overcorrection. Dr. Haje gave him a carinatum brace for a short period of time, and after that he continued the original treatment and managed to enter adult life with a healthy chest. In the first picture, you can see a 49 years old patient who was corrected in 9 months. On the second picture, a 29 years old man who was almost got fully fixed just under 3 months. This shows that age doesn't matter at all. In these two pictures, you can see two females treated both under a year. Other non-surgical methods can be used on females as the breast didn't let it. But as you can see here, with this method, it's not a problem at all. And finally, a quite severe case where the patient managed to fix his chest in 12 months. Here you can have a look at his CT scan too. The change is remarkable. His heart and lungs are no longer compressed by his rib cage. Carinatum cases. A severe pectus carinatum case. A 15 years old patient managed to fix his chest under a year. In the picture in the middle, you can see that he wore 2 braces, as Dr. Haje realized that to avoid overcorrection, it's easier to start with 2 braces for the carinatum patients. Very interesting carinatum case, as the second B picture is only 2 months after the first A picture. Overcorrection was shown, the carinatum turned into an excavatum, so a rib flare brace what used with excavatum patients was used to correct the overcorrection. Here you can see a female who happened to be overcorrected just within 2 months. This also proves why a rib flare brace is necessary since the beginning of the treatment. In this picture, you can see a 27 years old patient with carinatum who was fixed just under 3 months. This, again, shows that age doesn't really matter. Part 8. How to get the braces. At this point, I'm sure that I proved to you how effective this method can be. Now you wonder, how can you buy a brace like this? Dr. Sydney Haje passed away in 2012, but his legacy is still present in Brazil. The orthopectus clinic only make braces by person, so you have to be in Brazil. A clinic in London, United Kingdom, has their braces too, but I found their pricing £3,200, a little bit too much, considering what they offer. Still, they only make braces if they meet you in person. Even if you don't find these prices outrageous, going to Brazil if you live in the American continent, or go to the United Kingdom if you live in Europe, can be challenging, as there aren't many flights, you have to quarantine, and also the borders can be shut down anytime. To avoid this, I looked for an alternative solution, but I was let down, as the alternatives that you can buy online are garbage. If you have Pectus carinatum, you may came across braces around £400 range online, but the mechanics design of these braces are really poor, and most of the time you find it really hard to adjust it to your chest. Even if you can adjust it, these braces tend to push other areas of the chest as well, so making the treatment less effective, or you can even harm yourself with these. If you have Pectus excavatum, your case even worse. Most people only talk about these vacuum valves. I will talk about this later on. But you can't find anything about braces, except one, and that's the lacy brace. You can find many reviews how uncomfortable this brace is. This brace is actually do more harm than good. It compresses not just your lower ribs, but the whole abdominal or diaphragmatic breathing muscles too, creating hard time to breathe, leaving you with less oxygen in your body and the feeling of anxiety. This is why I decided I have to make my own brace. And I knew I have to address the biggest problem what Dr. Sydney Haje method has, and that's how visible the brace is. He himself admitted that the success of the therapy is on one thing, and that is that the patients who were open about their treatment, wore the braces outside of their clothes, were the most successful with their treatment. On the other hand, those who didn't wear the braces for at least 23 hours a day eventually gave up the treatment as they had no positive results. People with chest deformities have enough insecurities about how their chests look like, and it's understandable that they don't want to go to school or work with such a braces, becoming a target for bullies. On top of that, sleeping in these hard braces is something unimaginable for me in any position. This is why I had an idea. Instead of one brace, what if I would make two? One brace I made, similar to what Dr. Sydney Haje made, which is the hard brace. It's tough, durable, made out of metal and hard plastic, with soft padding, capable of creating high force, and despite your breathing in any physical activities, it's stable and doesn't move at all. The high pulling force is created by a ratcheting mechanism, so even children or disabled people can easily adjust it. On the contrary, it's big, heavy, you can't hide it, you can't sleep well in it. The other brace is solely my design, and I call it the soft brace. The main feature of this brace is that it's basically invisible even in slim, tailored clothing. It's very comfortable and soft, but it's doing its job very well by pulling the chest too. You can sleep with it, you feel like after some time you don't even wear a brace. On the other hand, it's not that tough, it wasn't meant to be used by doing physical activities. These two bracing systems, what I made, complement each other. You can wear the soft brace while you are at school, work, doing free time activities, and while you are sleeping. Also, you can wear the hard brace while you are at home or somewhere where you don't mind if people see the brace, and when you are training. This way you can easily reach the daily 23 hours or more brace wearing time which is essential for the progression. Also, every brace will be specially made for your chest. I will require many measurements and photos of your chest to make it suitable for your needs. At a fixed price, you will receive 2 braces, soft and a hard brace, with many accessories, but this is just the first part of my method. With this fixed price, you will receive a detailed training program, a membership, and a supervision program too. I know for sure that many of you got motivated immediately, but being motivated and being disciplined is 2 different things. Motivation is a spark, a flame which comes fast and goes fast. It can get you moving, but in the end of the day, discipline is what will make you to reach your goals. This is why I decided, just by making the braces won't help everyone. I have to make sure that you wear those braces and you do the proper training with it. The training is a fundamental part of a successful treatment. Reforming your chest is all about applying forces in different areas of your chest. A proper training program can significantly speed up your progression. Every customer will receive videos about training routines, but specially made for while you are wearing the brace. If you become my customer, you automatically become a member of a close group which we run on Facebook. All the members of the group will be brace owners, so together we will form a community to help each other. On top of that, every member will be under my supervision too, for making sure that you wear the brace and do the training. The first time you receive the brace, I will help you how to put it on and how to adjust the resistance of the braces. After this, in the first 4 weeks, I will require you to update me every week with a picture of your chest and with a summary about how much you wore the brace this week, any problems, complications, how training is going, basically anything that possibly had an influence on your progression. If you will be successful in the first 4 weeks, then congrats, you made a new good habit for yourself. After the first month, I will need you to update me monthly with a picture of your chest to make sure that your progression is going into the direction what we want. This supervision will continue until you are officially chest deformity free. This video is made in June 2021. As you've seen on the pictures and in the study, most of the patients fixed their chest under a year. My goal is to make all of you chest deformity free before the summer of 2022. Part 9. Why bracing is better than surgery. Other alternative methods. You can find many personal experiences online from those with Pectus Excavatum who underwent the surgery, Nos, Ravitch, whatever, and they had a successful surgery. But right after the bar removal, everyone experiences some sort of a regression. But approximately 1/3 of the patients experience total regression, which means that their chest sunk back to where it was before the surgery. The reason for this, they didn't fix the root of the problem. They didn't fix the rib flaring, their breathing is still wrong. They lack muscle strength in general, but especially core spinal stabilizer and rear deltoid strength, together with total lack of flexibility. With my method, although you don't fix your chest overnight, but you do fix those areas which could result in regression. And now let's talk about another alternative method, which is the vacuum bell. The vacuum bell is what's the main alternative treatment of the Pectus Excavatum community. First of all, I think the device is great, it's a good invention, but I think people aren't thinking about it correctly. Most people want to use it for as long as they just can, but its main principle is stretching, and I don't think you should stretch something for excessive amount of time. And the other main problem is the vacuum itself. Our body can handle pressure much better than vacuum. Maybe because in nature we would never even could contact vacuum at all. It can leave water blisters and hematoma, but nothing permanent. If it's used with responsibility, I would call it a safe device. By responsibility, I mean you should use it as you stretch a muscle. I think more frequent but shorter periods of use could be more beneficial than putting it on for 4 to 6 hours or even more and then waiting for a miracle. I think it can be a great addition for the bracing, and people showed that vacuum bell and heavy training can lead to correction. What I found is although it takes approximately 2 years, my main concern is that we don't have a scientific evidence if this correction is permanent or not. And I think it all depends on how much the user managed to fix his or her rib flaring. I'm working on to make a new type of vacuum bell, but this work is in progress. I think by the end of this summer I should finish it. Part 10. How to apply for my program. Starts in July 20. In these pictures you can see me wearing my braces. These braces were made by me, but actually not for me. But let me explain it to you. The two pictures where I showed the soft and hard brace is me, but I made those braces for a local guy who has Pectus Excavatum. I can't test the braces on myself as my two internal bars start to really hurt after a short period of time, and also as I have Pectus Excavatum, Pectus CARINATUM complex, I need two bracing systems at once. By the end of this year, hopefully, I will be able to undergo the removal surgery, so I can start my own treatment, but the pandemic makes things harder than ever. So the very first tester is him, and I can already tell that the braces are working, but I can't show any long-term results. The main reason why I'm here, because I want to act not just locally, but globally. I don't want anyone to go through what I went through. To prove that my program and my braces are working, I need people who would participate and prove that it's working. For this, I need your help. At first, I just want to gather as much information as possible. If you have any type of chest deformity and you are looking for a solution, please contact me in the following email: pectusconnectus@gmail.com, and send me the following. First, a picture of your chest from the front on both left and right side, so 3 pictures altogether, with good lighting. If you want to, you can send me more pictures or even a video. Second, your age and how long do you have chest deformity. Is it worsening? And if you have a diagnosis or an X-ray CT scan from a doctor, you can send that too. Third, do you do any sport training, and where do you live? Which country? If you send me these in an email to pectusconnectus@gmail.com, you will receive an answer with the following. First, I'm going to tell you what type of chest deformity you have. Keep in mind, it's not a diagnosis, just my opinion. Second, an answer that can I make a brace for you or not? If yes, then how many, what type of brace you need. If I'm able to make a brace for your chest, I will inform you about that. And I will send you another message later, probably July, where I will ask for the specific dimensions of your chest and the details how can you make the purchase. But don't worry about that. Right now just send me the pictures and those informations and relax, I will contact you. If you come across by this video on Facebook, Reddit or any other platform, please don't text me there, rather send me an email so I can keep track of things more easily at one place. Before you would ask, the pricing of the 2 braces and the program is going to be around £400 altogether, but I'm still working that out. Also, shipping costs and time depends on where you live. Obviously, if you require more than 2 braces, for example CARINATUM, the price will be higher, but not twice as much, don't worry. If your progression isn't going into the direction where we want it to, despite the protocol what I made, and you require additional bracing, I will be here for you. If the brace foot broke, I will make new parts for it, but as I planned, everyone will receive many secondary parts with the braces, so if anything goes bad, you won't be out of a brace. I hope you found this video useful, and I believe together we can make a difference. Next video coming soon. Don't forget to subscribe for future content and send me an email to pectusconnectus@gmail.com. Thanks for watching.